Hundreds across the country have now received the COVID-19 vaccine. Dr. Mario Ramirez is one of them. He got his first dose today. Dr. Ramirez is an emergency physician in Virginia and managing director of Opportunity Labs. The doctor's with us now. Doctor, great to see you. How are you feeling? Side effects?
Good to see you, Shepard. Feeling great. Had a little bit of soreness in the arm earlier today and a slight headache, but that sort of resolved after just a little while, and feeling really good now.
Great news. A few weeks and you'll be good to go. Hey, a healthcare worker in Alaska today had what was described as a serious allergic reaction to the vaccine, the Pfizer vaccine. Should there be more observation of people with a history of problems with vaccines?
Well, I think this is something that we need to watch, Shepard. I think it's important to put it in context, though. On an average ER shift, and I see 20 to 25 patients a day, probably 2 or 3 of those patients will come in with severe allergic reactions. So the complaint itself is not something that we're not used to treating. I think what's important anytime you're rolling out a new drug is to monitor for side effects. And I think these drugs are being given under the right conditions. I think the right thing was done here. The nurse was, directly observed, and she had a side effect and she was treated appropriately. She sounds to be doing well. So it's something for us to keep on, but I want to make sure that we don't blow it out of proportion for what it is.
Doctor, I want to show our viewers what you got today, a dosing card similar to what a lot of people will be receiving. Is this enough to make sure people get a second dose? It's pretty critical.
Well, this is one part of, several mechanisms, Shepard. So this is sort of the paper trail, if you will, that helps, remind me to make sure and go back and get a second dose. But importantly, when I received my first dose, you actually have to sign up for the second dose at the same time. And we know from prior trials with the HPV vaccine, for instance, that making people schedule that second visit goes a long way to compliance. I also get regular feedback from the CDC, who checks in on me daily through a system called vSafe. And sort of having those constant reminders will help make sure that people go back for their second doses. So I think there's several systems in place, and I'm confident that we'll have good retention.
Dr. Ramirez, you worked on pandemics for HHS during the Obama administration. NBC News reported today that though vaccines are rolling out in rich countries like ours, some of the poorer countries around the globe are going to have to wait months, maybe even years to see doses. Are you concerned about what happens with this pandemic, even after we're all sufficiently vaccinated around here?
It's certainly a real concern, Shepard, and I think this is a question that folks who have worked in pandemics have, been concerned about for a long time, is how do we equitably distribute access to these life-saving resources? And I think there are organizations out there that are doing great work to try to minimize this sort of discordance. One of the ones that I think does a great job is the Coalition for Epidemic Preparedness Initiative, or CEPI. And one of the things that I think was unfortunate about the Trump administration's approach to the pandemic was that they chose not to participate in the COVAX facility. The COVAX facility was a way for emerging countries to jointly invest in vaccines and have access to all of these resources. That's part of why the United States' involvement in multilateral regimes like this is so important, because it helps allow countries like that have access to these resources.
Dr. Mario Ramirez, great of you to be here. Thanks so much. Shepard Smith here. Thanks for watching CNBC on YouTube.